On behalf of Ajanta, I welcome all national delegates and our international speaker, Dr. Daniel, to the International Speaker Program on Collagen. It's been more than 50 years. Ajanta Pharma is serving healthcare needs both in local and global markets through empathy, innovation, and technology. We are an Indian multinational company with a presence in more than 30 countries, with 500 products and more than 7,000 Agentites are working with us. We have advanced R&D center with more than 750 scientists. They are building the complete value chain. We have 2 US FDA approved plants at Paitan and Dahej, in addition to other plant facilities at Pithampur, Guwahati, and Waluj. Ajanta has almost 150 products which have been introduced first time in India. We have strong presence in 4 therapeutic segments of cardiology, ophthalmology, dermatology, and pain with the brand like Metexcel, Feburic, Pelocap. Ajanta has been designated as Young Maker of the Year award by the hands of our Honorable Prime Minister, Mr. Modi. In addition to various other recognitions like Giants of Tomorrow, Great Place to Work, has been bestowed Ajanta. We are honored to host this distinguished gathering of experts, researchers, and professionals from India and international countries, united by a shared passion for advancing knowledge on collagen and its contribution in osteoarthritis. So Ajanta always strives to be your scientific partner. So let's make this program a valuable experience for everyone. And we look forward to an inspiring session ahead. Now I request my colleague, Dr. Vaishali, to welcome all speakers and introduce them. Thank you.
A very good evening, one and all. I am Vaishali Nath, medical advisor at Ajanta Pharma. So it's an absolute honor to welcome you all to this highly anticipated international speaker program, which is on a very interesting topic, that is the future of pain and mobility solutions, the collagen way. Today, we are going to embark on a journey to explore some of the groundbreaking achievements and some of the evolving role of collagen-based therapies. We are privileged to have with us a distinguished panel of experts, including renowned international, national speakers, our esteemed moderator, and panelist. To start with, I would extend my welcome for our international speaker, Dr. Daniel, who is head of R&D, Bioberica, Spain. His main research line is in the joint, immune, and metabolic health. He has co-authored in more than 50 publications and communication in scientific congresses as well. I welcome you, sir, and namaste. I would also like to extend my warm welcome, and it's honor to have as a moderator with us Dr. Ram Prabhu sir, who is already a renowned face in India, who is an HOD at Desai Hospital for more than 30 years now. He is also HOD at Wadia Hospital and medical director at Mukund Hospital. I welcome you, sir, and surely your discussion will be very dynamic and engaging towards the journey. I welcome you, sir, on board.
Thank you, Vaishali.
We also have with us our very energetic national speaker, Dr. A.N. Mukherjee, sir, who is accredited by Royal College of Surgeons at England. He is also president of Kolkata IORA and NKOC, and he is also recognized with the esteemed award of Shushruta Award. I welcome you, sir, on board for our today's discussion. And also we welcome, sir. We also have with us an esteemed panelist, Dr. Swarnendu Samanta, sir, who is a consultant at Peerless Hospital, Kolkata. He has also received fellowship at Dr. A.K. Sengupta Memorial. I welcome you, sir, on board for today's meeting.
Thank you.
We also have with us Dr. Sanjay Londe, who is, the slide is not moving. Can we go to the next slide, please? Dr. Sanjay Londe, sir, who is from Mumbai. The slide is not moving.
Go ahead. You come back again to Sanjay.
Okay, sure, sir. We also have with us a renowned name, that is Dr. C. Rex, sir, who is a consultant at orthopedic and trauma surgeon, professor of head of department orthopedics at Rex Ortho Hospital, Coimbatore. I welcome you, sir, on board for today's interesting discussion.
Thank you.
We also have on board with us Dr. Palash Gupta, who had done a fellowship in robotic and joint replacement in trauma. He is director at Sri Balaji Action Medical Institute, New Delhi. And I apologize for the technical glitches. But with that, and without waiting further, let's dive into the enlightening session that will definitely promise us to shape the future of the pain and mobility care. I welcome Dr. Ram Prabhu, sir, to take it forward. Thank you.
Good evening, everyone. First of all, let me welcome Professor Daniel Martinez from Spain, who is a pioneer and researcher in this molecule. And we are going to talk very exciting lectures, discussion, and interaction today on the molecules which is revolutionize the treatment and management of osteoarthritis. Osteoarthritis, as all of us know, has a problem with the pain and the mobility of the joints. And this has been a bugbear in orthopedic surgeons' treatment module in managing the elderly, the senior citizens, and people having osteoarthritis. And here we have a path-breaking molecule, which is Aflapin and Collagen Peptide II, which is going to really change the whole scenario of management in the management in the osteoarthritis. And that is what we are going to discuss today with the presence of Professor Martinez. We also have our Indian faculty, as been told, Dr. Mukherjee, Dr. Samanta, Dr. C. Rex, Dr. Sanjay Londe, and Dr. Palash. So all of us are going to discuss this. And I'm so happy that all across India, there are so many people who have logged in today. We are going to take the questions at the end of the session. And in case if you have any questions, you can always put it on the chat box, which we can take those questions as our discussion proceeds. So let me welcome Professor Daniel Martinez in the beginning, who is going to talk about this because it is his basically a product which he has worked, his research, and he is going to be the best person who is going to talk about this molecule. Professor Martinez.
Thank you. Thank you very much for the introduction, and well, good evening to everyone. Right now, I'm going to share my presentation. Well, as has been said, my name is Daniel Martinez Puig, and I work in the research department of Biomerica as a head of human and animal health. And in this role, I've been involved in the scientific development of Collagen. And this is what I'm going to explain during the next minutes. But first of all, just a few words about collagen. As you know, collagens are the most abundant proteins in the extracellular matrix of the connective tissues. And according to their supramolecular structure, there are different types of collagen. Type II collagen is the main structural protein in the cartilage, where it provides tensile strength and thickness to the tissue. So structurally, the collagen has a triple helix of polypeptide chains. If the collagen ingredient is obtained using a process that maintains the triple helix structure, then the ingredient obtained is defined as native or undenatured collagen. And this has, some aspects, some critical aspects in terms of the biologic activity, as I will explain later. So collagen is an ingredient that provides native type II collagen and is extracted from chicken sternum using a strictly controlled manufacturing process that ensures type II collagen to maintain its triple helix structure and their activity. So the orally taken native collagen works through an immune-mediated mechanism of action that is known as oral tolerance. To explain oral tolerance, just a few words about what could happen with the cartilage during the aging process. So due to repetitive loads or impacts or overloads, small fragments of cartilage could be broken and released into the synovial space. This exposes the components of the cartilage, mainly type II collagen, to immune cells. So fragments of collagen could be recognized as antigens or neoantigens, and an immune response could be organized against articular cartilage, thus leading to more inflammation that promotes the release of more fragments and then more recognition. So this is like a vicious circle that goes to degradation and inflammation and could lead to the appearance of the joint pain. And long term favors the appearance of joint degradation. So one possibility to stop this vicious cycle is through the oral administration of native type II collagen. When provided orally, native type II collagen reach pair patches at the intestinal level, and then it is recognized by antigen-presenting cells, by immune cells, and as a result of this interaction, there is an immune response that ends up with a reduction of inflammation at cartilage level. Just some detail about this mechanism. As a result of this interaction between the triple helix of the collagen and antigen-presenting cells, so the T-regulatory lymphocytes are differentiated and migrate to the cartilage where they have a cascade of response, leading to the T and B cells to differentiate and to inhibit the inflammatory response against cartilage. So this mechanism of action is totally different from the mechanism described, for example, for hydrolyzed collagen, as you could see here in the left. So in hydrolyzed collagen, there are some peptides. Some of these are absorbed through the enterocytes, and those that are absorbed, if there are like bioactive peptides, they could reach systemic circulation, they could reach the cartilage and exert some effects. So the differences in the mechanism of action in comparing hydrolyzed collagen or native type II collagen leads to different properties. So here there is just a summary. The most important is that native type II collagen does not require absorption because there is a cell interaction at the intestinal mucosa, and the mechanism is immune mediated. And this is the reason why the dose is only 40 milligrams per day. While in the case of hydrolyzed collagen, it requires absorption. The mechanism is not immune mediated, and then the dose is up to 10 grams per day. So, next is the studies. I have here a summary of different studies in which the effects of collagen has been tested. This first study here, we have an animal model in which the osteoarthritis was induced in rats with monoiode acetate. This is a standard osteoarthritic model, and in here we evaluated the effect of different doses of native type II collagen after the induction of osteoarthritis with an intraarticular injection. So different assessments were made, including behavioral and also including biochemical and histochemical evaluation. Here you could see the pain response, the power pressure test, and the activity level, the locomotor activity. And as you could see here, you have on the black column the control group, the healthy group, here the disease group, and here we have the groups in which they are supplemented with the native type II collagen. As you can see, there is certain recovery even at day 7 and at day 40 in the level of the pain tolerance, and there is also some recovery in the level of activity. So, here the results are very significant from the first controls at 7 days. And this is just in terms of activity and in terms of pain behavior. But if we go further, we could see that this is strongly correlated by the levels of interleukin-1 beta, which is one cytokine which is showing inflammation at plasma level, so it's systemic inflammation. You can see here that there is a strong reduction leading even to the normal values in the treated animals. But if we go deeper to the cartilage, what we see here is that in the collagen group there is less inflammation as measured by the infiltration of inflammatory cells into the cartilage. So here there is like more cells infiltrated. So then here what we have is the plasmatic levels of C2C. C2C is a biomarker of cartilage destruction, specific of type 2. So it reflects what is happening in terms of degradation of the cartilage. And as you could see here, there is, well, a reduction of this biomarker. So it is showing protection of the cartilage in this specific animal model. Then we also have studies in humans. This is a study in patients with osteoarthritis. This is a randomized single-blind study in which patients with osteoarthritis of the knee were recruited and divided into two groups. One was treated with acetaminophen and the other with acetaminophen plus native type II collagen during a period of 3 months. And here we could see a summary of the main results. These are the results of the WOMAC score. The results are expressed as difference on 3 months. Well, here we have 3 months. Here we have the basal data. So you have the both for group with acetaminophen and for the group of the combination. So as you could see here, there is improvement just in the group of the combination with acetaminophen and native type II collagen in terms of the WOMAC pain score, the physical score, even the total score, which is statistically significant, while there is no difference in the control group. Besides this, we also detected improvements in terms of pain measured with the BAS score. This is pain during walking. And we also determined the effect of different biomarkers, both biomarkers of collagen destruction. As you could see here, there are 3 biomarkers. In all of them, there is a reduction. So meaning that there is an improvement in the group which is supplemented with a native type II collagen, but differences didn't reach statistical significance as compared to the control in any of the 3. It's just numerical differences in these parameters. So here we have the results. Well, here we have another study. In this study, this is a retrospective study in which patients with osteoarthritis were evaluated during a period of 1 year. And there were 2 groups. One was the group that was treated with glucosamine and chondroitin, like standard therapy, and the other group that was well treated with glucosamine, chondroitin, and in addition, native type II collagen. And the data collected here showed the following. So it is interesting because it is data which is related to the protection of the cartilage. Here you could see the levels of CTX2, which is a biomarker of joint degradation, of cartilage integrity, we could say. And well, the results are presented here at 3 time points. This is baseline, this is 6 months, this is 1 year. You could see here in the group that has the triple combination, the chondroitin, glucosamine, and collagen, there is a reduction, which is statistically significant. In the group that there is chondroitin and glucosamine, there is also a significant reduction. However, here we could see that there is a different behavior between groups. So there is like more consistent reduction over time in the group that has a collagen in addition. More or less, we see also this pattern of response in this parameter. This parameter is the radiological score. And you could see here that there is a progression in both groups, meaning the progression that there is some more like bone decay. This is 1 year as compared to the baseline, but you could see here that the progression is lower. There is more progression of the disease in the group. There is less progression. Here there is more progression. Here there is less progression. this is the group that has the supplementation with collagen, meaning that there is certain additional benefit in terms of protection of the cartilage. Well, and here we have another study. This is a randomized controlled trial in which with women, only with women with osteoarthritis of the knee. In this case, 39 adult women with knee osteoarthritis, aged between 40 and 80 years, that were divided in 3 groups. One group was the control group with no intervention. The other was the group treated with native type II collagen during these 3 months. And then there is another group that received just exercise therapy, 12 sessions of exercise. So you could see here the results of the functional scores. This is 6 minutes walking time, the test up and go, the range of motion, and as you could see here, the results in blue is the baseline. At the end is this is the final at this 90 days. And as you could see here, in the 2 intervention groups, say in the exercise group and also in what is called here the treatment group, there is an improvement in terms of both scores, in terms of 6 minutes walking time, also in terms of time and go score. There is no improvement in the control group with the non-intervention. Well, here there is certain, but there are differences. And even here in the range of motion, there is an increase on the range of motion with the 2 groups in vitreous intervention. So we see like more or less an equivalent magnitude of improvement with the collagen as compared to the exercise therapy, taking into account that this is the comparison between groups and no effect here in the control group. And here we have the WOMAC score. As you could see, there are improvements again in with the 2 interventions, both with exercise, both with the native type II collagen, with the WOMAC pain, with the rigidity score, and even with the total WOMAC. And here, well, we have the results of the last study. The main difference with this last study is a study that is not made with osteoarthritic population. It is with healthy population, but who experienced like joint discomfort during activity. And well, this is a randomized double-blind placebo-controlled study in which 74 healthy subjects with joint discomfort were included and were divided into 2 groups. One was supplemented with placebo during a period of 6 months, the other with native type II collagen at a dose of 40 milligrams per day during the same period of time. And during this time, different measures were obtained. Here, the results are from the KIOS score. In this study, it was used the KIOS score instead of the WOMAC score because this was a healthy population, and this score was validated for conditions that are different from osteoarthritis, which is the case. And here you could see the results for the pain subscale. In this case, the results are expressed as difference from baseline at days 60, 90, 120, 180. So you could see that there is a progressive improvement in the Collagen supplemented group, which reached a statistical significance as compared to the baseline at the control at 120 days and at the end. But here you could see that at the end of the study, there is also an improvement in the placebo group, which is the placebo effect. So we know that there is always certain degree of placebo effect in the studies in which we evaluated joint health. And for this reason, a sub-analysis was pre-planned. And in this case, the sub-analysis was consisted in dividing the population into 2 subgroups according to the basal pain. So we know, because it has been described, that the greater the basal pain, the greater the placebo effect. And this is what we obtained here, because on the right, you could see the results on the subpopulation with less basal pain. So more or less, we could say that the populations were balanced. And here you could see that with this population, we see more or less the same pattern of response with the total population here as with the less basal pain population in the Collagen group. So there is also improvement from day 120. However, here we could see that how the placebo effect or the placebo response is less pronounced. So then there are differences between groups at the very end of the study. Then with the quality of life score, we see more or less the same pattern of response, the same picture here. Here we have the general population, and there is also a progressive increase, a progressive improvement of this parameter over the evaluated period. In this case, the differences as compared to the baseline are statistically significant from day 90. And well, here again, at the very end of the study, there is well, certain improvement in the placebo group. However, when we make like the sub-analysis, we see again that there is same improvement in the Collagen group, in this case, statistically significant from the first control at 60 days. But again, there is less effect or less response in the placebo supplemented group. So again, reaching differences between groups at the very end of the study. Here we have another parameter that was evaluated in this study, that was time to recover, because this was people who experienced pain during activity. So they did an activity protocol at this control visit, and then we measured like the time to recover from the discomfort. And results are expressed here are the ratio difference as compared to the baseline. So here in this slide, you could see that how in the Collagen group, this parameter remained constant during the whole study. So you could see there are no differences. However, in the placebo group, there is a progressive worsening of this parameter. So meaning that there is, on each control, there is more time required to recover from pain. So at the end of the study, there were like differences between groups on time to recover from pain. So this is just a brief summary of the studies with native type 2 collagen. So just in terms of summary, so well, the collagen is a natural direct ingredient providing native and denatured type 2 collagen that supports joint health at a dose of 40 milligrams per day through a specific immune-mediated mechanism of action. This ingredient has been manufactured and researched by Bioiberica, which is well, a Spanish-based company, which is a leader in heparin and in the other biologic active ingredients for pharmaceutical and for nutraceutical industries. And the ingredient is available in Europe and US. Well, thank you very much for your time and for your attention.
Thank you very much, Professor Martinez, for an excellent, though short, but it has really shown us and told us regarding the advantages of using undenatured collagen type 2, also Aflapin, and in reducing the pain and increasing the mobility, along with some kind of physiotherapy, and that always helps, as we orthopedic surgeons know. So can we take some questions now, Vaishali? If there are some questions, or we can go to Professor Mukherjee.
So I think now there are no such question visible in the box. So we can, sir, go ahead with our national speaker presentation. Post that, sir.
Now, with the permission of Dr. Ram Prabhu, that's I
Yes,
have got a query to Dr. Daniel, because
Yes.
when the type 2 undenatured collagen came into the market, or the research came, we started to provide this undenatured collagen from the chicken sternum. So how you take this undenatured collagen nowadays for the purpose of using?
Yeah, the origin of the collagen, of the native type 2 collagen, is from chicken cartilage, from the chicken sternum. This is the origin.
Sir, I just wanted to add a word with Swarnendu that earlier the source was bovine, chicken cartilage, bovine, and some of them even from the whale's bones or something they used to say. So Swarnendu was asking, what is the source at this moment? Because in our India, we have a big issue about green dot and red dot. So that's the issue what we are asking, what is the source? Is it a veg or it's a non-veg? I know it will be quite a surprising thing to you to listen to this thing, but this is the issue. So
No,
we
no,
are asking.
that's clear. Yeah. That's clear. So for collagen, the origin is 100% chicken cartilage from the sternum. Yeah,
That's good. That's good.
yeah.
So to answer you,
And
uh,
if I can ask one more question
yeah,
as the discussions are
Palash,
going on. Sir, thanks. One question I want to ask. Yes, I do understand, but a lot of people they have a preference. They are either vegan or they are only vegetarian, so they don't want to take anti-nature type 2 collagen. In addition to this, what I wanted to ask the opinion of the panel was, as we are using many things which are so-called collagen based, like Boswellia or Tiger Claw or Aflapin also. Have you used a product which does not have undenatured collagen and had other particles? Does that thing works?
yeah, good question. Professor Martinez, please.
Yes, yeah. Thank you. That's a very interesting point as well. So, well, we know that the response of undenatured type 2 collagen is very specific. So it requires the recognition of certain epitopes which are present on the collagen chain, so it is specific from collagen type 2. So, and
Yeah.
collagens are only present on the animal sources. So if it's not animal, so there are other substances which are not collagen, and then this specific mechanism would not appear. There could be other mechanisms, but the specific mechanism of oral tolerance to type 2, to type 2 collagen would be specific from animal origin and specific of the type of collagen and also on the structure of the collagen. So, well, there could be other ingredients, but not with the specific mechanism because it's only animal.
So, Professor Mukherjee and Samantha and Palash, as you know, this is a non-vegetarian product which has a red dot. So, any variant in that collagen, so it won't be exactly undenatured collagen type 2, but there are variants of it which could be maybe same efficacy or maybe little less, as Professor Martinez has said. Yeah. So, now again, Dr.
Sir,
Palash, yes. Yes, Dr.
I
Pal.
am taking the advantage of Dr. Rex being here. So I might ask one or two more questions. There is no denying, no doubt that undenatured type 2 collagen is a beautiful, beautiful drug. Even in its pure form, without any additives, it is giving results. We have no denying the fact it is a good salt which you people have made. What I wanted to ask is if supposing in a patient who is a vegan or a vegetarian, and I want only to use Aflapin and Boswellia Serrata per se, I haven't found any combination by any drug manufacturer which does not include undenatured collagen along with these things. If they have, it doesn't work on the bone. It works on the soft tissues. Am I clear or do I have to go again?
Palash, let me just correct you a bit. First of all, it's not a drug, it's a nutraceutical. So
Yeah.
please do not compare it with any drug because drugs have a different kind of pathway. It has a different kind of functionality. So this is a nutraceutical. And as you said, probably in Indian markets, we may not be having a combination without undenatured type 2 collagen. But there are products which are available and which has Alpha-Pin and other products. And Bioberica has been specifically a company which has been there from Spain and which has perhaps worldwide distributed this. And they are the pioneers in this. So I think, and I had a fortune of going to Spain and actually visiting them. So I know about.
Thank you. Thank you.
Yeah. So I think can we go ahead, Vaishali, with Professor
sir.
Mukherjee's lecture, and
Sure,
then
sir.
we can take your company profile.
Surely, sir.
Yes. Please.
Over to Mukherjee, sir. Welcome.
Good evening. Can you, I have, can you see my slide?
No, sir.
I have shared
Yeah,
it.
yeah, sir. It is just started.
It's just started.
It is visible, sir.
Visible.
You just need to make it full screen, sir.
Yeah, I'm making it. It's coming, but it's
Visible, sir. Visible.
Oh, so to start with, I say that I'm just a doctor. I'm not a professor. So, but I have given my whole life in orthopedics. It's my humble 40 years in this orthopedics. So, and I'm really lucky today to have Ram Prabhu, very old friend, philosopher, and senior, maybe a friend of mine, and Sharnendu, who is there. They are all being very well wisher and giving me all, guiding me everything's in my life. So to talk about today, as a welcome keynote, I say that this is something our bread and butter. Sorry, I have a bad throat today. This is something which is our bread and butter. We face this thing every day and we treat this thing every day. To come with this, as we know, the optimization of osteoarthritis by the treatment of Aflapin and native collagen disorder, which my previous speaker, my friend, has very well elaborated. So now coming to the cause, I think as an orthopedic surgeon, I don't have to tell you much of the cause, the mechanical stress, the obesity, the aging, the injury, the diabetes. All these things in turn, they initiates the inflammatory cytokinins, which damage by in terms of what you call the cartilage, and cartilage destruction is there. So this antigenic stimulation damage the type 2 collagen, and that in turns the collagen destruction is there. That's the cycle. So coming to the arthritis philosophy, so it is the pathophysiology wise, it's a immune pathway. It has a 5 blocks pathway. Immune pathway releases the cartilage derived from the antigen type 2 collagen, T cell activation, T cell mediated cartilage degeneration. And 5 blocks pathway is, as we know, the inflammatory mediators, pain, inflammation, that increase MMP activity leading to cartilage destruction. So progressive cartilage destruction happens by these two. These are the arthritic progression. So mechanical and immune pathway in the pathogenesis of OA, as we know, osteoarthritis mechanical is here, which hits the cartilage in 5 blocks, and that mechanical pathway in turn activate the T cells, and that immune pathway, the T cells, and breakdown of the cartilage matrix happen, and the osteoarthritis sets in. So cartilage preservation and regeneration in osteoarthritis is our goal, what we are looking for. So why cartilage preservation is important in OA? Because we all know this hyaline cartilage is in absence of blood. And to be very honest, what I have been taught around 45 years back, and I still now believe once hyaline cartilage is gone, it's gone forever. The thing which takes thereafter is fibrocartilage, which may be of the same, may not be absolutely of the same biomechanics and the biomechanical thing, but they take over the thing. So it's a direct vascular network and significant important, and it prevents invasive procedures. Like there are so many invasive procedures now have come up across, counting from A to Z, but this methodologies, this prevents invasive procedure. It is less invasive because it's just a small tablet to swallow, but it is early intervention is very mandatory. The timely cartilage prevention has to be needed. So early diagnosis and early prevention is very important. Hence, preserving cartilage is a vital maintenance joint function, preserving osteoarthritis and enhancing quality of life. However, following the cartilage regeneration, articular cartilage, chondral defect, chondral lesion, osteochondral defect, osteochondral, this we all know, and at the end, the AVN. So coming to the unmet need of the conservative treat of osteoarthritis is basically what we had. These NSAIDs. NSAIDs really speak on your heart, your stomach, your chest, and your kidneys. So we have these problems worrying with the NSAIDs and paracetamol. They have an also high risk of GI and the liver function and risk of development renal impairment. Therefore, there is a need to explore a new means of OA treatment where we can bypass these complications. So, role of supplement in osteoarthritic management, that has become a trend of treatment nowadays. In the recent years, supplements have emerged in potential therapeutic part in osteoarthritis treatment. Supplement can help the prevention and management of the articular cartilage in osteoarthritis, added benefits and side effects. And there are the things which can be taken here that promotes endogenous cartilage generation, inhibits the chondrocyte apocyte, and it arrests the cartilage degeneration. These are the ways how they work. So the native unregenerated collagen, as my friend said, it is structurally protein primarily present in cartilage tissue. Collagen type 2 in its native form operates through the specific immune mediator pathway. The oral tolerance is definitely as active suppression of the immune response. The oral nutrition is the way where we can really what you said, the administration of the narrative understand the collagen type 2 and decreases the autoimmune response. So the role of the native unregenerated cartilage, as we all know, the backbone of the articular cartilage, it mainly type 2 cartilage which is lost in early osteoarthritis. So native understand collagen type 2 is transported to the pair patches of the intestine. In the pair patches is activate the T cells which becomes the Trach cells, and those what you call active the Trach cells, and that migrate the pair patches into the bloodstream. Trach cells, in recognition of the harmful components, they anti-inflammatory cytokines are thereon, and IL-4 and IL-10, they have been found to coming on the picture. So the Trach cells reduces joint inflammation and promotes cartilage repair. This is the hypothesis. So coming to the, this is the this is the hypothesis as it goes. So the what you call the benefit of the native collagen. What is the benefit? It attenuates the immune response against the destroyed joint cartilage. It suppresses the inflammatory regeneration. It increases the functional mobility of the joint and altered the pain. So the role of native unregenerated collagen, I don't want to go much in the alpha. As we say, the Aflapin is an innovative synergetic formulation which includes B, that we know, Boswellia Serrata, which has been a time old in our Indian herbs, extracted from the AKBA along with B. Serrata. So this Aflapin inhibits pro-inflammatory cytokinins. So potential anti-inflammatory and anti-arthritic and analgesic drug. So Aflapin demonstrate a favorable safe profile in low risk of adverse effect. So giving Aflapin in selected way, we can have a coming again the anti-inflammatory, anti-arthritic, and analgesic effect with the medicine, which gives a relief to the patient primarily. So the control of osteoarthritis progress and relief from arthritic symptom is there. So Aflapin score from the Boswellia Serrata, how Aflapin is better. You can see Aflapin, the bioavailability is much more than Boswellia Serrata. This is Boswellia, this is Aflapin. So it is more bioavailable. So coming to the point that why the combination of native collagen and Aflapin is there. Like, why not native collagen alone? Why Aflapin is added? This combination basically acts in two ways. One, 5 blocks inhibition of the Aflapin and mechanical pathway, and another is immune pathway regulates the undenatured collagen type 2. So one acts as an anti-inflammatory analgesic, and another one acts as a regeneration of the cartilage. So they both club together and give a better result for formation of the of new cartilage and relief of the osteoarthritis and the pain and symptom wise. So safer alternative of OA patient for comorbidities like those who have diabetes, heart, and other lung problem. This is a safer product. So dose, duration, and therapy. Aflapin is 100 to 250 milligram. Duration of therapy is 3 months. And native undenatured collagen, as my friend said, it's 10 milligram. Duration is 6 months. So what we had in our combination here in UC Move is a native undenatured type 2 collagen, which is 40, which is as per very much in the dose schedule, and Aflapin, which is 100 milligram, which is the most baseline and safest for this. And this is given for a standard phase of 3 months for the treatment. And now coming to the what clinical evidence we have to say this. Why I am saying this? So the combination of the Aflapin and the native undegenerated type 2 collagen is the manage of osteoarthritis with evidence that suggests the efficiency and safety of undegenerated type 2 collagen plus Aflapin in osteoarthritis is managed. And the method we can see, as I told you, this is a once in a day dose schedule, and patients was assessed from 5, 15, 30, 60, and 90 days, and it's been found that they are doing well. So these are some studies which has been carried on. You can see the effect of treatment on VAS score subject recorded. This is the VAS score which has been taken in between. This is the VAS score for the male subject, and this is for the female subject, and this is for the all subject. You can see, surprisingly, the male subjects, they get a, what I found, little bit better results than the female subject. I don't know why, but this has been found here. Similarly, the WOMAC score has been also calculated, the total, and the male and the female after a period of 5 days, 15 days, as I told you, 30 days, 60 days, and 90 days. You can say see quite remarkable improvement. And here again, with the WOMAC score, I could find that females are a little bit better than the male. Overall, they are as an average 18.10 at the end of 90 days. So this we can see that they are really working well with the undenatured collagen and Aflapin. So in Aflapin, okay. So conclusion, improves patients' compliance, native undegenerated type 2 collagen and Aflapin thought they are complementary mechanism. They work hand in hand. The combination of native untreated type 2 collagen and Aflapin was effective during the inflammation and joint stiffness. The combination was slow down in disease progression and severe and safe effective treatment of osteoarthritis. So Aflapin is managed of osteoarthritis. What evidence says? So the systemic review of meta-analysis of Aflapin shows a superior efficacy over Boswellia therapy in osteoarthritis. This is a study of 2024. The Aflapin improves the knee function and cartilage morphology in mild to moderate osteoarthritis, random placebo-controlled study by Kumar et al. In 24. And a undenatured type 2 collagen is managed of osteoarthritis. What is the evidence says? The evidence says study of undenatured type 2 collagen of the knee osteoarthritis by Jimmy et al. In 2019. It say that it works, reduces in the OMAC score in UC over 120 days. And this has been found that it really worked well. You can see this, what do you call this table here to find the results, and you can see the p-value of the things. So again, the safety and effectiveness of undenatured type 2 collagen in osteoarthritis, a non-interventional prospective multicentric Indian study by Mehra et al. In 2019. There they have been used this 40 milligram of undenatured type 2 collagen, and physical examination were assigned and days were calculated, and they have been found that treatment with undenatured collagen type 2 associated with a significant reduction of OMAC score. So p-value 0.001 and VAS score was also at the baseline, and you can see the values here that they have really worked very well. This is in the negative, minus 49. So undenatured type 2 collagen and randomized double-blind placebo-controlled study in healthy volunteer by Lugo et al. 2030. This has seen this group showed significant improvement in the knee extension compared to the placebo. At day 19, UC2 showed significant improvement with the knee extension. UC2 group exercise longer before experience of the joint discomfort from the day 120, and 5 subjects in UC2 group reported no pain during the what you call the temporal protocol period. So effect of the native type 2 collagen on knee osteoarthritis, a randomized controlled trial by Baclian in 2015 that says that after 3 months, significant improvement in joint pain, in working, function, OMAN, and quality of life were observed in the AC and CAI group. So coming to the clinical efficacy of undenatured type 2 collagen in knee osteoarthritis, randomized controlled study by Yatis et al. By 2020, it said both treatment shows a reduction of OMAC score in AC and UC2 was significantly better than AC alone. So safety and efficacy underwent with type 2 collagen and knee osteoarthritis treatment, a clinical trial by Corley and et al. In 2009 that says that UC2 treatment showed significant improvement across all assessment in 90 days. So efficiency, tolerability, and unreacted type 2 collagen and the knee osteoarthritis, randomized double-blind placebo-controlled study by Lugo et al. In 2016 that say UC2 group shows significant reduction in overall OMAC and significant improvement in OMAC subscales. You can see there the pain, stiffness, physical function, they have been all improved. So the interactive questions where we have are the thought-provoking. What are the challenges that you experience while prescribing this conventional treatment for osteoarthritis? Do you think prescribing natural components can be a promising therapy in the management of osteoarthritis? Do you currently prescribe collagen for osteoarthritis, and which specific ingredient product you prefer? Next is, what is your opinion for prescribing Aflapin over the Boswellia Serrata extract formulation management of osteoarthritis? What is your opinion for prescribing Native Collagen Type II? What is your opinion for prescribing Aflapin beneficially for the cardiac patients? And how do you assess the efficacy combination with Native 2 and Aflapin? For any effective therapeutic benefit, what should be the optimum duration of the therapy? Do you face any challenges of the patient after having this? And with this, thank you. I am really thank you for all for listening for a boring presentation of mine. Thank you once again.
Thank you, Dr. Mukherjee, for making this so simple. Actually, it is pretty complicated The immunology is something which orthopedic surgeons really do not like to know or hear about, but you have really made it very simple, showing excellent case studies and giving an advantage of giving Aflapin and also undenatured collagen type 2. So now, if Dr. Sanjay Londe has come, we would like to share his experience of using, because he has vast and immense experience of using this molecule a lot, and we would like to invite him. He is a personal friend of mine, and he is from Mumbai, and we would like to really hear from him because he has really extensive experience about osteoarthritis, the medical management as well as the surgical management. Over to you, Dr. Londe.
Good evening to everybody. Thank you, Ram Prabhu sir. I think without wasting time, I'm a huge fan of these nutraceuticals, as has been aptly said by you and Dr. Mukherjee, that nowadays we are seeing a lot of patients with osteoarthritis because the patients are living longer and age expectancy of the Indian patients have increased, but and not all patients are candidates for a knee replacement or a hip replacement surgery, as all of us are aware. In fact, with the changing sort of dynamics, we are nowadays seeing even younger patients in their 35 to 45, 50 years of age who typically present with sort of patellofemoral osteoarthritis or early medial compartment arthritis. And we cannot continuously give these patients, NSAIDs, as has been already elucidated, that they do have their own side effects. Even non other molecules like tramadol, they have a tendency to get dependency, and the patient might get hooked or addicted to those. So I've been using these nutraceuticals for quite long time, since 90% of my practice is knee replacement as well as arthroscopic surgery. And when first the Colaflex came, the powder sachet form, I've been using that, and I'm extremely happy with the results. And since this undenatured type 2 collagen has come, uh, albeit the patient has to take as Dr. Mukherjee had asked the question, how long the therapy should be given. I think the for waiting having the best benefit, the patient should at least minimum take them therapy for about 3 months. And you have to tell the patient at the beginning that it may not work immediately. So usually in my clinical practice, what I do, if the patient's creatinine and EGFR is good, I usually give some NSAID along with antacid for about 10 to 14 days. And on day one, I start these nutraceuticals or basically cartilage, building drugs, so that by that time the patient's their effect starts kicking in, the patient's pain is taken care of by the NSAIDs, and then I withdraw these NSAIDs at 10 to 14 days. By that time the effect of these molecules or these nutraceuticals, they come in, and the patient I'm extremely happy with the results of these were sort of grade 3 Lawrence osteoarthritis of the knee. Majority of them, their WOMAC score, function and stiffness, as well as Oxford knee score, that really improves, and probably they can delay their operation, or they can probably delay the development of grade 4 KL osteoarthritis. Only one thing, sort of one interesting observation, as you're aware, there are a lot of companies now flooding the market with collagen, and there is a lot of cost difference between the original sort of type 2 undenatured collagen vis-a-vis the other collagens which we have from some other companies or cheaper products. Since because I am on the panel for this particular discussion, I am not praising the innovator, but definitely there is a difference. That is my observation. If you try to choose a cheaper product, or if for some reason patient takes some generic product, nothing against it, and don't quote me, but the effect is not as good. So actually, I want to ask, though I am slightly aware of the question, the answer of the question, why only the original, this particular undenatured type 2 collagen, 40 milligrams per day, along with Aflapin or other combinations from Bioberica, it works very well in the patients, whereas certain other sort of collagens, they don't have that much effect. Probably it has to do with the purity and the source or the mechanism from which it is derived, and that's why it produces this immune tolerance or oral tolerance, leading to immunomodulation and T cell activation, leading to decrease collagen degradation at the level of the cell or at the level of the articular cartilage. So this is my more or less the experience. I'm extremely happy with these molecules. I do use glucosamine, but I usually use glucosamine in grade 1 to grade 2 KL osteoarthritis. And I have certain reservations about using glucosamine, especially in patients with diabetes mellitus. Now, as you are aware, I think in any branch of medicine, there are certain papers which are there for glucosamine. There are certain papers which are there against glucosamine. But overall, certain papers, they do conclude that the glucose level might be slightly raised in patients with diabetes with the use of glucosamine. So usually I try to avoid glucosamine in these patients. Another question is which comes to the mind, that certain elderly patients who have high creatinine or borderline creatinine with compromised EGFR, how safe are these molecules? I think probably professor from Spain, Daniel Martinez, will be the best person to answer that. But the answer which I got from searching through the literature, it since these molecules, they don't get absorbed much and they act by oral tolerance and immunomodulation. These molecules are perfectly safe for even patients with borderline creatinine. I would like to have a opinion of other panelists who are eminent surgeons like Dr. Samanta, Dr. Mukherjee, and Dr. Ram Prabhu. What is your opinion, and what are your thoughts, including Dr. Palash and our guest from the professor from Spain?
Yeah. So Dr. Samanta, if you can tell me, I'll let you know at the end my opinion and my views on this.
Can you once more put the question in proper way, because
No,
what was
I understood the question. Question is that I completely agree that what Dr. Sanjay was telling, that we are really apprehensive about using the glucosamine in the diabetic group. I completely agree on that. I specifically, if the patient is diabetic, I don't prescribe them, because there is few literatures that support that some people, they may have some altered glucose after taking the medicine for 3 to 6 months. So it's better to avoid. Second question is that why this particular product of undenatured collagen type 2, why it acts better in this formulation. I think previously people were thinking how when you prescribe the collagen, how it is going to be absorbed in the gastric acid, how it is actually, whether it is really effective, yes or no. But the mechanism of action of this unnatural collagen by this T cell activation with the oral tolerance mechanism, it is completely now been proven that it mediates through the different pathway, and it helps in cartilage regeneration, and also it suppresses the degeneration. So there is no doubt that this molecule is going to work. And the combination of Aflapin, as because it has got the anti-inflammatory effect. So basically this is a boon that one takes care of the immune part, and another one takes care of the other chemical products which degrades the cartilage by the inflammatory process. So this combination is really good. I think this is going to work, and there is no doubt about it.
What
I
is
can
your opinion, Dr. Rex? What is your opinion about this? The same question that has been asked.
Just I agree with all the speakers in the general opinion, but few things I just want to highlight is early arthritis. Always we prefer something like a nutraceuticals to prescribe rather than giving any painkillers or any short acting conventional medication. So definitely the patients are very happy to have something more protective, counterproductive drug. So it's easy to convince them, and also being a nutraceutical again is a big advantage. The patients are also happy mentally. Also, they feel that the side effects are very less and easy to adhere to the, and compliance is also is good in the long term. So that is one of the ways to convince the patient to take it in the long term. And I'm very happy with the product because it gives a a complementary effect of pain relief as well with Aflapin. So which is again is good, and we don't need to add up any painkillers, and it makes less number of tablets because these patients sometimes take a lot of medications. So reducing the number of tablets is definitely a big boon for them, and easy to convince the patients as well. And regular, along with that, regular exercise is very important. But if you see our patients, especially the female patients, they're not, just adherent to the exercise protocol and all those things. They're happy to take the tablets. Is easy for them to swallow rather than go for regular exercise. So those patients also, I think it's definitely a big boon to have a tablet, nutraceutical tablet, to easy to take and get relief of the problem. So these counterproductive drugs definitely works well. But the only thing in the market, as rightly said, flooded with a lot of combinations with the UZ2, along with Aflapin and the devil's claw and the roseate extract, vitamin C, hyaluronic acid. So with a lot of combinations, we are at a loss to say which combination really works well, because these two definitely has got a definite role, but others also may have an additive value. So which we don't know really, but I use all these combinations, and definitely I feel my patients are very happy with what I give playing with the nutraceuticals. So definitely it's got a role. Thank you.
So, thank you very much, Dr. Rex. This question is to Dr. Palash. How collagen 2 is helpful in relieving pain as compared to other collagen?
Honestly, Dr. Prabhu, I have used UC2 since last 4 5 years, and in my opinion, UC2 undenatured works beautifully. Like I said before, also, yeah, I'm having results, and of course, when I start the medicines, I always keep patient for first 10 to 14 days on some sort of NSAIDs, and then I taper it off. I don't stop it altogether. I taper it off gradually, and usually I give undaged collagen to my patient for around 3 to 4 months. That is what schedule I am following. And yes, like a previous speaker said very rightly, there are so many combinations available in the market. It is very difficult for us to know, okay, which combination is the best. One thing we are sure of, undenatured collagen is something which cannot be substituted. Now the second part comes of Aflapin and Devil Claw and Boswellia and curcumin and XYZ, which are really beneficial because the number of medicines we are adding are increasing the cost of the medicine to the patient. So that thing has to be taken care of. Okay, things which are really working should be given. Otherwise, to reduce the cost of the medicine to the patient, as we are from a developing country, all of us should take a call on this. Ki, yes, this is the best combination, and this is the beneficial to the patient.
Yeah,
That is all I expect from you, sir.
Yeah. So, Dr. Mukherjee, can you tell me whether Aflapin can be given in diabetics, also in case patients having any cardiac comorbidity? Can we give them?
Good evening once again. Because why I said good evening, because like starting of the evening, when I was quite young, like 25 years back, I'm
You're
just
still young, Dr. Mukherjee. You're very young and energetic.
at 65.
Only.
So what I was going to tell that at the evening of the life, when we was the young, around 25 to 30 years back, as Ram Prabhu also must be remembering that megaflex and other things, that glucosamine and chondroitin came in. They used to talk that the sixth sulfur chain has an GAGS chain, has an hydrophilic part left where they can add on an extra water molecule which can lubricate the what you call fluids in the knee. I mean the hyaluronic acid part they used to justify like this. But why I am saying this thing, to just clarify that diabetic part, it has been proved times and times again, it is a pro-diabetogenic part. So far, Aflapin, as my boss has asked me to answer, that Aflapin is concerned, it's really a drug which is safe cardiac safety is there, renal safety is there, hepatic safety is there. Aflapin is being used in Indian herb in Manu Sangita and Charak Sangita for years. This is the herb of India. Aflapin, as well as my goosebumps, as well as the what you call the other one, the curcuma longa. These are two drugs of Indian herbs. But however, due to this patency problem and other, some of them has gone. But this is a drug which has been used for hundred of years without any complications. And if trials have been there, and if you can only use Aflapin, that gives you relief from the pain and arthralgia, what you call arthralgia. So the combination is quite reasonable, because one part, this native collagen 2, which is an immune modulated pathway for acting in osteoarthritis. Earlier there was a blunt belief जे ये खा लेते हैं तो ये कोलाजन खाते हैं, कोलाजन जाके घुटना में बैठ जाता है. This not that. It whips your pairs patches, turns the T cells, and the T cells takes the message to your joint to reduce the destruction of the joint cartilage and start regeneration of the fibrocartilage. However, so this royal combination of Aflapin and native 2 cartilage, I believe, and I am using this UC move, I should not take the name, that's what I am saying, from the pretty long time, from their other companies. I was the launcher of this product by the other company, the earlier company. And this is one product which is quite effective. And as you all know, single dose, everyone knows, it's khatam. पहला कुछ दिन जैसा दूसरा डॉक्टर साहब लोगों ने बोला, कुछ दर्द का दवाई, कुछ फिजियोथेरेपी, लाइफस्टाइल मॉडिफिकेशन, ये सब
Thank you, Dr. Mukherjee.
Thank you.
Vaishali has been raising her hand for quite some time. Over to you, Vaishali.
Thank you, sir. So the discussion is going so wonderful that we are still glued to the screen. And for that, I would like to definitely say special thanks to our speaker for the wonderful insight and knowledge sharing, to our moderator, Dr. Ram Prabhu sir, for the wonderful moderation, and to our panelist for the thought-provoking insight. To give us the vote of thanks, I would like to call Sunil Pandey sir, who is National Sales Head for the division. I welcome you, sir.
Yeah, thanks, Vaishali. But before I give the vote of thanks, I would like to ask Dr. Ram Prabhu what he was saying. Dr. Ram Prabhu, you were saying something. There are some questions. I think so. It's coming here.
Yeah. So the questions that Dr. Mukherjee asked, they're very relevant and thought-provoking. Actually, most of the questions have been answered.
Yeah.
But in case if somebody wants to throw some light, Dr. Samanta or Dr. Gupta, they can think about those questions. It could be also shared on the screen, and we can take them threadbare if we have some time.
Yeah. I think so. Most of the questions are already covered. While the discussion was happening, I was listening that some of the doctors were asking whether this type 2 collagen in India is available with the same manufacturer which is there outside India. I would say yes. Bioberica is our partner, and UC Move is our name, which is available with the original type 2 collagen. So thanks to each one of you for listening very, very patiently. On behalf of Ajanta, as we have concluded this enriching webinar event, it is my privilege to extend our heartfelt thanks on behalf of Ajanta to all the doctors, panelists. First and foremost, I would like to express our deepest gratitude to our esteemed speaker, Dr. Daniel Martinez, who your insight, doctor, and your expertise is truly invaluable. The session was a treasure of knowledge, sparkling, stimulating discussions, and providing us with the new perspective on the future of pain and mobility solution, the collagen way, and not just a painkiller or NSAIDs. I also want to extend a sincere thank you to all our moderators, to all our speakers, especially a moderator who's very, very senior, Dr. Ram Prabhu, sir. Your skillful guidance and ensuring this discussion happens while the presentation was happening and engaging all these speakers. It was very informative. Thank you, Doctor. To our esteemed national speaker, Dr. A.N. Mukherjee is very, very jolly, making it very, very, I would say, lively, and then very, very comfortable for all the doctors who have attended. All the panelists, Dr. Shunendu, Samantha, Dr. Londe, Dr. Rex, and Dr. Palash, thank you for giving your opinion and insight about your clinical use. It is incredibly grateful for your contribution. Your diverse perspective and in-depth discussions have provided us with the comprehensive understanding of this topics which is covered here. Thank you once again, all of you. A big thanks to all the participants who have been here and listening, engaging, and very enthusiastically sending questions to our team.